Hello, my name is Gabriella Rangel, and I will be talking about post-traumatic stress disorder, or PTSD. When talking of children specifically, there is different criteria in the DSM-5 for children than there are for adults. For instance, recently the DSM-5 added separate criteria for children who are 6 and under. They have done this so that the criteria could be more developmentally appropriate. Before the DSM-5, there was no criteria for children 6 and under experiencing PTSD. It is important to stress that though a child may have gone through a traumatic experience, this does not mean that they will develop PTSD, but going through something traumatic will put them at a higher risk for it. I will be focusing on the criteria for children who are 6 and under. Research has shown that between 30 and 40% of children who have experienced physical or sexual abuse will end up developing PTSD. Someone is diagnosed with PTSD after a person experiences symptoms for at least a month after a traumatic event has happened. A traumatic experience can be sexual abuse, school violence, sudden loss of a loved one, a life-threatening illness, and much more. In order to be diagnosed, a child must have had to experience any of these things in at least one of the following ways. The child directly experienced the event. The child witnessed the event. This doesn't include seeing things on television or seeing things on social media. Or the child learned of a traumatic experience that happened to their caregiver. They must have at least one intrusive symptom, such as recurring and upsetting memories of the traumatic event that can be witnessed through play, nightmares, fear when reminded of the event, being easily startled, and having flashbacks. They must also experience at least one avoidance symptom or change in his or her thoughts and mood. Some avoidance symptoms are negative emotions like fear and shame, loss of interest in things they once found fun, social withdrawal, a reduced expression of positive emotions, and being unable to remember important parts of what happened. Lastly, at least one of the following changes in his or her arousal or reactivity must be seen. These things can be increased irritability, difficulty concentrating, and problems with sleeping. Functioning is affected by a child becoming distant, lashing out, not being able to find joy in things they once loved to do, and becoming increasingly anxious, aggressive, nervous, or it can also be a combination of the three. When you are a kid, you are still trying to navigate the world and find out your likes and your dislikes. Experiencing PTSD can alter their sense of themselves in the world. Potential interventions for PTSD in children is cognitive behavioral therapy, also known as CBT. By taking a child to CBT, a child can learn to handle their anxieties and learn to control how they feel of the situation that led them to the PTSD. Another potential intervention is medication to help with depression or to help with anxiety that developed after they experienced the traumatic event. Medication can be given depending on the situation and the age of the child. By taking medication, it can help the child to feel calmer. When prescribing medication, it is important to take the medicine as scheduled for it to be as effective as it possibly can. There are also some common comorbid disorders that exist with PTSD in children. This can include mood disorders, behavioral disorders, and anxiety disorders. This can also come with suicidal ideation. If PTSD does go untreated, the child is at risk of having severe depression when they are older, and that can often lead into abusing drugs or abusing alcohol.